really interesting thing that came out was that there seemed to be this very vulnerable period in the first 10 to maybe 14 days after hospital discharge, where a lot of the readmissions for patients after COVID really occurred early in those first 10 days after they went home. And when we looked at why they came back to the hospital, by far the most common reasons were COVID, pneumonia, sepsis. So it really seemed to be that patients were experiencing this kind of delayed worsening of their symptoms that then brought them back to their hospital. So really for the purpose of giving something to kind of compare this to, we compared this to similar patients who were discharged alive from hospitalization for other types of pneumonia, not COVID, or for heart failure, which are two really common causes for hospitalization and are known to have high rates of readmission, returning to the hospital, or death in the next 2 months. So we found that when we looked out to 60 days, actually the rates of these outcomes were lower in patients with COVID compared to these similar patients hospitalized for other causes. And likewise, there have been other studies coming out around the same time showing that even people, who survive are also left oftentimes with kind of lingering symptoms, not able to go back to work. And I think these different types of research together, I think really try to reinforce the importance of still remaining vigilant about masking, physical distancing, all the things that we do, and really continuing to be vigilant, even as we still have, vaccine coming into our communities. We need to be vigilant until really the entire pandemic has been squelched out